Spastic paraplegia type 4, or SPG4 for short, is the most common form of hereditary spastic paraplegia, a group of genetic neurodegenerative disorders characterized by progressive weakness and spasticity of the lower limbs. There are over 80 known types of spastic paraplegia, each caused by mutations in a different gene, and each given a number in the order they were discovered. SPG4 is caused by changes in a gene called SPAST, which provides instructions for making a protein called spastin. Spastin's job is to cut and reshape microtubules, which are tube-like structures used to transport molecules from one part of the cell to another. When transport along nerve fibers is disrupted, essential substances like nutrients, signaling molecules, and waste products can't reach where they're needed. Over time, this causes nerve cells, and particularly the long axons that carry movement signals from the brain to the legs, to become stressed or damaged. Mutations in the SPAST gene are usually inherited within families. However, the severity and age of onset can vary, even among family members with the same mutation. Now, the hallmark symptom of SPG4 is progressive lower limb spasticity or stiffness. As a result, the legs may feel tight or rigid, especially after sitting for a long time. Individuals have difficulties with balance and thus might walk with a stiff or scissoring gait. Additionally, they may notice it's harder to keep up with others when walking long distances or going uphill, and they grow tired more easily. A physical exam may reveal overactive tendon reflexes, meaning when a clinician taps on a tendon, like the one just below the kneecap, the reflex is stronger and quicker than normal. This happens because the nerves controlling the reflexes are more excitable than usual. The same motor neuron damage that causes stiffness and reflex changes in the legs can also affect the nerve control of the bladder, resulting in urinary symptoms like increased urinary frequency and incontinence. While SPG4 usually causes a pure form of hereditary spastic paraplegia that only affects the lower limbs, some people may experience additional symptoms. These can include numbness or tingling in the feet, poor coordination, cognitive changes, speech difficulties, or in very rare cases, seizures. Diagnosis of SPG4 is suspected based on clinical features and physical exam findings, especially if there's a family history of the condition. An MRI may show thinning of the spinal cord, but often appears normal in early stages. Genetic testing can confirm the diagnosis by identifying mutations in the SPAST gene. Currently, there is no cure for SPG4, or a way to entirely stop its progression. Management involves medications like baclofen or tizanidine to reduce spasticity, and anticholinergic agents to improve bladder function. With physical therapy and strengthening exercises, most people stay active and independent for many years. In more advanced stages, walking aids like canes, walkers, or ankle braces can be used to assist with stability. Alright, as a quick recap. Spastic paraplegia type 4 is a genetic condition that primarily causes progressive stiffness and weakness in the legs. It usually begins gradually and progresses slowly, with symptoms like leg stiffness, weakness, overactive reflexes, and urinary urgency. While there is no cure, treatment with physical therapy, medications, and mobility support can improve quality of life. Helping current and future clinicians focus, learn, retain, and thrive. Learn more